Hey everybody, how are you?
Hey, Stan.
Hey, how you doing?
Excellent. How are you?
All good.
How was Alaska?
How is Alaska? Actually, where Jeremiah is driving somewhere. I think he just popped in. He'll tell you. He got a rental car and he is out in the where are you? Out in the Alaska outback somewhere. You're muted.
Come on, JJ, get it together.
I
Where are
got
you?
it. So I was logged in the first time, it wouldn't let me in. I'm too far on the other end of the earth. But yeah, I've got a 2 hour drive to Seward, which should be some beautiful country. So I'll be able to fill you all in. But had a
Is there snow
beautiful,
there now?
yeah, there is on the peaks and there will be with where I'm headed. Yeah. And it was like 50 some degrees last night and still sunlight at 2 a.m.
Wow.
Yeah, it was actually, and it was sunlight at 4 a.m. when I woke up. So I don't know that the sun ever sets up here in the summertime. So what's happening in New Jersey?
It's 105 degrees tomorrow. It's gonna be nice. And I have one of my buddies doing Stimpod on tennis elbow from playing golf, and he's in the next room. So he's living the hard life, playing a lot of golf and getting golfer's elbow, tennis elbow. We did a rib fracture today. I did a woman who has bilateral cervical radiculopathy at C7. Um, Not much. It's a quiet day.
Cool. Well, 2 days ago, I think it was what is today? Thursday. So on Tuesday, uh, Jeremiah flew up. When did you get there? Monday or Tuesday?
Tuesday. So I got up at 4 a.m., got to the airport, flew up there, and we were doing a workshop by 2 p.m. Alaska time. So I had about an hour and a half to go eat, and then we had two workshops back to back in the afternoon.
Okay, that's right. And so I flew.
You should have you should have seen some funky stuff up there, I hope. What did you see that was interesting?
They've had issues with viral load due to long COVID or funky COVID stuff that's bothering some of them. It was probably the more problematic ones of people that we had. And then, diabetes type 2 is just a big one for uh, a lot of those folks. So, realistically, that's kind of where it's at because they're conservative healthcare, regardless of who you are, just throwing on a lot of meds. So about everybody in the group had either had type 2 diabetes or diabetes, about over 80%, and the rest of them had all been put on gabapentin or Neurontin or of some sort. So um, they were just blown away because they don't get any education on anything else.
Yeah, we had about 43 people at the 2 o'clock workshop and about exactly the same number
Yep.
for the 6 o'clock workshop. Yeah, it was great.
I thought there'd be some people with Lyme disease or stuff due to tick and some other, and doesn't mean that one or two of them weren't, but most of it was all due to viral load stuff that just has never been addressed. So it was kind of interesting to map that out and kind of support them in kind of what was really going on. And there's a lot of people that have they don't even test for vitamin D, and they all know there's vitamin D deficiency because of 6 months of the year with the sunlight issues, and then even being outside because of the intensity. So um, they're on vitamin D, but nobody takes it. And you ask some of them that are, and their vitamin D level is still at a 14. So um, there's probably some you know behind the scenes supported autoimmune or just globalized adrenal load stuff that's clear off. And that was a big education I had with most people, Kieran.
And we did not treat any moose injuries or bear injuries.
Nope.
And no amputations.
No, not with this group. I actually thought there would be, but we didn't.
Those are actually a lot of fun
Hmm.
in a demented kind of way.
Hmm. And I
Anybody?
figured, go ahead.
No, I was just going to ask if anybody has a question or a story they want to share.
I have a question.
Sure.
I'm doing a workshop in a couple weeks, and I added sciatica to the topic. So I'm fine with doing the things for neuropathy, but when I show it for sciatica, what I'm not going to get those same kind of wow. What
You
can I
should.
expect? I should? You think I
Yeah,
still
so I mean, posterior tibial is sciatica, so you can do it. If you want to make it more proximal to where the nerve originates in it, I would do it below the knee in the popliteal fossa and have it run down the foot because they'll feel that like, oh, that's what it feels like. So you'll have the wow. You don't
okay?
want to go up to the butt because it's going to be too difficult to find, and you don't go above the knee because there's a weird sort of transmission factor involving the back of the knee. So once you drop below the knee itself, it's very easy when the calf is separating, and
Yeah.
they'll get the wow factor because if it's true sciatica, makes you just make sure you can differentiate what it actually is.
Okay. And so I'd still put the grounding pad on the foot just like I
Yeah,
would.
same thing.
And
Yeah.
Yeah,
okay. Okay.
you'll
Thank you.
get the wow.
Okay.
And just realize treatment for those folks post, um, you're going to have to worry about some positioning and getting them in sideline. But for demonstration for the workshop, Kieran's 100% right. Just realize treatment for those folks, you may not want them in a slump or a loaded position for too long to go through all of the protocol, but
Oh,
for sure they're going to get it because that's one of the things we had up here because the clinic had used it a little bit is they were having issues because they didn't want to turn it up as high as they needed to um, for common pronial. And the challenge was they were going up behind the knee to find the space to get things for the wow factor for the foot. And when we showed them, down by the fibular head and just turn the intensity up. So you're going to be right in the same area. So 100% you can keep the same protocol, same everything, and you'll be just fine.
okay.
So I have a question.
Sure.
I was wondering, okay, so at times I get, obviously really good contractions of the muscle, and other times I'm feeling more of a nerve pain that goes down the nerve. Is there a reason you want one more than the other?
So I'm not clear what you mean by that.
So using the Stimpod, I've been doing it on myself a lot, and sometimes I feel like I'm right on the nerve, and I feel like a sharp pain that goes down the nerve,
You're
and other
feeling a
times
pain.
a pain,
You're
yeah, yeah, it
you're
hurt like a burning pain.
turn it down.
Okay. And then, but other times I'll get it somewhere and it'll be more of a muscle contraction.
So it's like the
So,
sweet spot. So that's the same way with everyone. That's why you have them hold the pen themselves because like you're looking for that sweet spot. And
okay.
then you identify that and then you say you hold this here, keep this sensation
Okay.
because you're going to know you obviously know the better sweet spot on yourself than I would as the provider. And same thing with your patients. You just want to look around and look for the sweet spot.
Okay. So you never want to go for that deeper like nerve pain.
I'm not looking to have a burning sensation on anybody.
Okay.
If you get a muscular contraction, that's actually ideal. Um,
That's
so,
what I was wondering.
but don't expect that all the time. That's the whole thing.
Okay.
And you may get a few scar sensory feedbacks that are similar, and then you need to turn it down, like if you're on a knee or somewhere on the body where you'll have that because it's purely superficial. And so you may not get muscular, but when you know where the anatomy is agreed, I always educate everybody because we're assessing as we go through this. We always want you comfortable because if you create that nerve burning sensory stimuli, you're creating stress through the system. And one, they're not going to relax when it's going on. And you're also creating the same theory as the pain gate theory before, and that's not what we want. So you're probably just really close. And what I always tell people, leave it in the same spot and just tip it or rotate it or bend it a little bit, and it should pick up, because everybody thinks it needs to be immediate. And we had people again at this workshop, and I get them in every one, you're in the right spot, and it will take 3 or 4 minutes, and then all of a sudden everything kicks in. So just sometimes breathe and have some patience, that even if you know you're in the right spot, as long as it's not burning, just wait a little bit, move it, and it might take a minute, and then it'll finally kick in, because those nerves, if they haven't been working right, they need some potential and some support. And so it's easy for us to think, oh my gosh, I'm not there, I need to keep hunting. And you need to just let the body kind of also accept it and relax a bit too.
Great. Thank you.
Yep.
Who else has a question?
I do. I know I've asked this before, but just for more clarification, gentleman coming in with tremors in his left upper extremity, insidious onset. They don't know what causes them. The more anxious or revved up he gets, the more his tremors act up.
All right, so Julian, you just said that. Now tell me what you think. What do you think?
What I think is the pad on the fingertips, do the ulnar median nerve at the wrist, go up to the brachial plexus, keeping the pad on the fingers, and vagus nerve stimulation.
Yeah, because you said it right there. You said the more anxious he gets, the worse it gets.
Yeah.
So this is like self-manifested anxiety, stress, that's real. That's how his body's responding to stress, but you already know it. So like, just to clarify, so do the vagal stim first with him, just because you're
Oh, okay.
saying the anxious out, you can do it first and last. I don't care. It doesn't really matter. Like
5 and
this,
5 or
yeah, 5 and 5 would be great, but like you can try a bunch of different stuff and you'll probably get a good result.
Yeah.
But like if you want to treat it locally at the hand, just put the ground pad on the opposite one. If you want them to feel it from the shoulder going all the way down, then you use the ground pad as the facilitator. Do you understand what I'm saying?
yeah, is there a more benefit to having it same side versus
If you
opposite
feel
side?
like if it's generated, if he's acknowledging that it's from the shoulder down, then do it from the brachial plexus and just use the ground pad at the fingers. If it's just local to his hand, like this, do it locally. It's going to go both ways, but it's however you want them to feel it.
Okay. Maybe I'll try it both, see how he responds.
Yeah, it doesn't
Yeah.
you're not going to hurt him either way.
Yeah. Yeah. What kind of results have you had with tremors?
Great.
Really?
Just
Like
try it,
long
document
standing?
it. So like
Yeah.
just document it. Like
Yeah.
you literally said it. So it's like tremors. Like I've got a video from one of the first talks that I did. The woman had complete Parkinson's tremors like this,
Okay.
freaking out. Like I literally didn't say 2 words to her. I'm like, go in this room, lay down and breathe and do this and this. She comes out, no tremor for 3 days, zero. And she had a full Parkinsonian tremor. And she described the exact, her words told the whole story, just like you told me, right?
Yeah.
Anxiety and stress make the tremor worse. And like, if you guys heard this before, I'll just make it quick. She said that I got retired. She's like, I retired in November of whatever year. The tremor started in December. So she was retired from her job where all of her value in life existed. 1 month later, and she goes, it started with the thumb. I see her 5 years later, don't say anything to her, and she has no tremor.
Wow.
So she said the whole story, just like you said the story. Just
Yeah.
listen.
Okay.
And
All
do
right.
the Liberty patch with her as well.
With him. Yeah.
Yeah.
I'll try it. I'll try it. I mean, are you guys using the Liberty patch with everybody? Who's using the Liberty patch? I know Stan loves the Liberty patch. I haven't tried it much yet.
I love it. Yeah. I use it for myself personally. I can feel it kind of reminds me to activate my abs. Like it kind of just feels like it's kind of just my abs are more awake and on when I'm working.
Yeah,
Yeah, because I get some symptoms, some achy stuff if I'm not engaging my abs and I'm working all day doing mobs on people and stuff,
sure,
you
sure.
know. And so if I forget to engage my abs when I'm doing mobs and stuff, eventually I start to feel it. But like if I have the Liberty patch on, I don't have to think about it as much, I've noticed. And
Cool. All
that's
right.
really
I'll have
cool.
to try it more.
Yeah, seriously. And I put it on patients who are in like balance impaired, and then like immediately their balance is better. You know, we'll do balance testing before and then
Yeah,
after, and it's immediately better. And then they buy the patches. It's
yeah.
like one of the most popular patches in my clinic for sure.
Really?
Yeah.
Tanea, I think Tanea would be the queen of Liberty patches. Turn yourself on.
I'm the queen of all thing patches. All patches. I feel like a drug dealer. It's so bad. It's so bad. I just placed another order for patches, and I'm not even going to tell you the amount that I paid for patches. It's
I
crazy.
I saw that
I
actually.
know they're all around. They're all around that number, Stan. But I have to because I mean we've got like 5 packs left, and I ordered the array of them, and I can't keep them on the shelf. I cannot. They'll be gone in a minute. I'm just like, I refuse to pay any more each time. So I'm just like, I should order like double that so it extends my time. But I am like the patch queen. I am.
All
Yes.
right.
I'll
All
take the
right.
crown for that one.
The
Tanea,
REM patch
did you do
is
your talk yet?
Which talk?
I saw you advertised for
Oh, I
another
did.
neuropathy.
Yep. I did the wait list of the after the 3. Yes. I did it. Yeah. It was
How did it
Wait
amazing
go?
list
as per
after the
usual.
three.
Yes. Yes. And without my guys beside me, yeah. I think I
You
did
got your
okay.
big girl pants on and you
I
killed
put
it.
my big girl pants on. Yes. No, it was really good. It was really good. But I've actually had to treat myself here lately. So I tweaked my back again. I've had back surgery in 2023, sciatica, motor, decreased motor in my right leg. This is the opposite side. They were trying to send me out for surgery again, and then they were putting me on this high dose of steroids and all of this. And I was just like, the MRI was showing just like it wasn't just the one big bulge anymore. It was like 2 smaller ones. Didn't really look like it should have been doing what it was doing symptomatic wise. And I was just like, I'm not taking the steroids. If we're treating pain and inflammation, I treat pain and inflammation in my office. I was like, I stand up in front of everybody all the time and tell them, I mean, they gave me the gabapentin, they gave me the steroids, all the things. And I was like, there is no way that unless we are changing this mechanically with surgery that you're telling me I have to have right now because of the motor weakness, I'm not doing it. And I've been amazing. I've been great that exercising and all sorts. So I'm a believer and I tell my story every day now. It's like, yeah, so
Awesome.
that's me. But I got a lot of tremors too. I don't know what it's like the diagnosis of the quarter or something. Like I've got Parkinson's induced tremors, I've got insidious onset, but stress being at the base of everybody at the moment.
Yeah.
The lady got this Parkinson's and then she retired and now she's like having to be on like financial assistance and all of the her story is really sad. But hers got exacerbated with that as well. And I'm not getting the big like I want her trauma to like really go away. I tried the brachial plexus on her last time and went down the arm and added that to the vagal stem, like you said, Kieran, but
Like
Yeah.
she's just
it's
all wound
less. It's
up.
improving.
No,
Yeah,
but
she
she's
is.
she's all wound up like you're that woman with the stroke that I treated.
Mm-hmm.
Remember I did all that stuff
Mm-hmm.
on her head?
Mm-hmm. Yep.
And she was like, "Oh my God."
Yeah.
Like you have to unwind her also because it's like an onion. It's just like building up and
Yeah.
building up. You got to break her down to open it up.
Yeah. I think she needs that as well. And then plus the vertigo one that I wrote you about the other day, yesterday or day before yesterday. I think he's like that with the SCM and the scaling. He just needs to be released here because there's no reason he should be like this. So we're gonna try it.
And what's interesting too, you'll get more and more of them that they'll look back and their pattern says, "Oh yeah, it's within the last 4 or 6 years," when they start looking at their stories. So the stress component's a big one for everybody when the whole world changed supposedly in most parts. So that's the other
Yeah.
commonality that more and more people when they look at their timelines, it's like, oh crap, right? It's yeah, coincidentally, no non-coincidence that it was within the last 4 or 6 years. Well, agree. It's everybody's wound up from all that other stuff that's been going on, and now it's finally showing itself because they can't compensate anymore.
So do you have any bears or anything out the window where you are now, Jeremiah? Are you halfway there? Where are you?
No, I pulled over because I didn't want to drive and whatever. So no, there won't be any bears or fun stuff for about an hour. So there's just mountains beside me. But
Okay. Show us the mountains.
hang on 1 second. That way I can get out.
I do have one quick question.
Yeah.
Yep.
Karen, did I hear you say I have a lady, a lot of facial stuff going on, so doing all of the facial points and stuff, but she also gets tongue involvement. And are you saying, have I heard you say before that you can actually put it right on the tongue, like inside of her mouth?
Yeah, totally. No gel. Just
Okay, no gel,
clean it off with alcohol so she sees
yeah,
that it's clean and just put it in her mouth.
yes.
Well,
Okay.
if it's burning, like the burning tongue thing is a weird thing. That has to
I
do
want to
with
say
like
numbness is what she told me.
I
I
would
have
just
to
put
look
it
back
on
at her
it.
note.
Like
Yeah.
just put it on it.
I
She
have
definitely gets facial burning and stuff.
Yeah, you do all those points and then like you put it directly on her tongue. So like this is like educate her because these are all different cranial nerves.
She's
That
definitely been getting relief with the face and all of that. So she's like a believer. Like she's like, if I can I just like, do this every day? And I was like, you probably could.
yeah.
so
And again, I would think that it would be viral also.
Hmm.
So talk to her about the viral component of that and like the same stuff as always.
So
Thank you.
yeah, I have a case that I've talked to you guys about before. I'm seeing her again tonight, this afternoon late. She has that diagnosis of trigeminal neuralgia. Um, the onset's funky though. It is from a dental procedure, but initially it was just burning right above the tooth right after the procedure, and she freaked out about it. She actually ended up in the hospital because she couldn't sleep, and she was so anxious and stressed about the burning here that she was on. They put her on they tried all kinds of psychiatric medications. Nothing was helping because she was so freaked out about this burning thing. And then after she was pregnant and she gave birth to her child, well, they did a C-section. Then for 2 months, this burning went away, but she got burning in her tongue and lost her taste and smell. And so then she gets this diagnosis of trigeminal neuralgia, and 9 months later, she's seeing me. So she did like the vagal stem. She did let me put the pin on her tongue. I actually had her hold it. She had a lot of fear. We didn't have any change from doing it once with the pin on the tongue. She gets calm with the vagal stem, so she likes that. She has a lot of fear about putting the pin anywhere on her face, but I'm going to see if I can convince her to let me try it today.
So I would definitely
She
the
doesn't
way I
have burning here anymore. No burning here anymore. It's
so
just the tongue is like burning. Yeah.
I would still approach the original trauma
Okay.
after doing vagal stim.
Okay.
Because it's presenting more like CRPS or an RSD.
Yeah. Okay.
Just because it's one thing and then it manifested into something broader and different.
Okay.
So I would just look at the origin and see what that does and just take conservatively and just explain to her. If you want to explain it to her, explain it to her. So it's like this original incident created this whole manifestation of this whole other problem. So we want to address this first, and we're going to calm down your nervous system doing the vagal stim, and then you can put it right through her face, not even above where this like put it
Okay.
through her face on the tooth where the surgery was done.
Okay.
That would be the most conservative route to try to get efficacy.
Okay. All right. And just to the point where she feels a little tingling because she has like so much fear.
Yeah, just if you stimulate it at all, great. Let's do
Okay.
it.
Okay. So vagal
This
stem, pin on the original trauma area.
Yep. And
And should I also try to do? Can you get the power cord for that? The tongue as
I,
well, or leave it out?
I wouldn't even mess with the tongue to start. I would just try to get everything calmed down to begin
Okay.
with because she is so fear-based and jacked up.
Yeah.
Just I would explain to her the methodology just so she feels a little bit more comfortable.
Mm-hmm.
Like trust me, when you're treating CRPS or RSD, do vagal stim first and don't chase everything.
Mm-hmm.
Like if you chase everything, I've chased everything before thinking that I'm doing the right thing and I did the wrong thing.
Mm-hmm.
Like sometimes less is more in when you're dealing with
Okay.
these components.
Totally makes sense. Okay. So vagal stem. Yeah. I mean, one session she came in, she's getting like burning in her feet, like socks, and she came
That's
in and
so
she was, and I explained it to her. I told her this is treating like, this sounds like RSD, and I explained it to her what's going on. And then, she didn't want to do um, uh, she didn't want to do anything with electricity, at that point. And so I just did massage, calming breathing, calming meditative things, and some vibration technology, which she liked. And her
cool.
pain in her feet completely went away. All the burning went away. And I was like,
Great.
see, I explained it to her. I was like, her home program is to be doing vagal stem twice a day with a different tool. I'm going to be recommending she rent the Stimpod, but she's been using a different tool that stimulates the vagus nerve. It's just not as intense or not as strong, and do like 10 minutes of deep breathing with peaceful meditative practice
Great.
twice a day. So that's her home program. And I told her as many things as make you feel happy, joyful, things that calm you. That's your prescription. We got to get this nervous system calmed down, And I just been telling her, believe you can get better because you can, and focus on everything that's going well in your body because more is going well than what's not. And just trying to get her to be more focused on that because she's doing a lot of talking about like, well, I'm going to be anxious and fearful and afraid until this burning stops. And I was like, that's not going to help.
And there are like Facebook groups for everything. And I like go and try to like tease all these people and put videos on but it's always such a pity party and they all it's a pity party
Yeah.
and they just all feed into each other. So it's like this negative affirming condition that's never going to end. That's all virtually self-manifested.
Mm-hmm. Yeah.
Cool. Dr. Dubov, what's happening with your mom? He just got a stim pod. He wanted to use it with his mom who's had neuropathy symptoms in her feet, right?
So I used it yesterday for the first time. So it like right afterwards, there was a little bit more movement in her toes. She was able to bring him up a little bit more and separate them a little bit, which she wasn't doing before. So and I put the Liberty patch on her, so we'll see. Um,
Did
you
you
know,
tip her over?
no, I didn't try because she probably would have done because like her foot's not working. But yeah, so I'm going to probably do another treatment tomorrow on her and kind of go from there. But I didn't do the Vegas stim for some reason, just it didn't occur to me to do it. So next time I'm gonna do the Vegas stim on her as well after because she's very stressed out about her situation and it's a sudden onset. Nobody really knows why it happened, kind of thing, with the drop foot. So, and this is like five weeks now. So,
She has drop foot.
yeah. Mhm.
Like, do you have Russian stim also or no?
I was gonna get her some, but there was like a site that we were gonna get it.
Dude,
And
I've been recommending one from eBay that is a Chattanooga unit. I think it's like $300. It's like a
yeah,
legit Chattanooga unit that you can buy off of eBay.
okay,
Pretty sure it's
yeah,
300.
okay. It's Chattanooga. Okay, gotcha. Yeah, we
Just
saw
look
something else and they didn't have it on eBay too. Um, so and then how often should you do that?
every day.
Daily, yeah.
So you do the calf, you can do the anterior portion of the leg also, tibialis anterior, and you can do the calf and do all that.
Sure.
But I would do it after you do Stimpod.
After the Stimpod, okay.
You could actually probably do it concurrently when you think about it. I haven't done that, but I wouldn't be adverse to doing it.
Okay. She has red light therapy also at home. I guess she could use that as well. Right.
I don't know how much that's going to do for that, but it's not going to hurt her.
Yeah. Right. Yeah, just to keep so the Russian stim would just be like to just strengthen the muscles, right? So
it's going to cause the contraction. So you put it at as best you can figure out as the origin and insertion of the pads are going on the origin and insertion and crank it up.
Yeah. Okay. You guys treated gout attacks at all with Stimpod?
Yeah, I mean you can help with the pain, no problem.
Yeah. Okay. What would you do? Like if it's like, I don't know, big toe.
Put it on the big toe.
Just put it right on the area of pain.
Yep.
Gotcha.
It's a joint, man. Just put it on it.
Okay.
Julian, you understand? He just told you the answer.
Put it on it. Put it on it. Put it on it.
It's not a nerve. It's a joint.
Quick question. I had somebody, cervical radiculopathy, DDD, small HMP, did the trigger point on her trap. I did wrist, brachial plexus, then on her trap. After I did it on the trap, there was like a bump, like a lump of the muscle. Did I do too much of it? Does that sometimes happen? Stimulated the wrong nerve?
I mean, I'm not really understanding what you're talking about. It turned into a lump.
So there was like a lump on the muscle. Like instead of, you feel the muscle, then right afterwards there was like a lump on the muscle.
That's weird. Usually with the trigger points, they kind of dissipate. I haven't seen that.
Yeah. Okay. All right. We'll see if it happens again. Anything different for the cervical? I mean, with the nerves on the spine, are you putting them right on there?
You could put it, so it's like, I don't like treating like posterior cervical. I don't generally do that. I would look at the brachial plexus and then pick the nerve that was affected, and I would run it down the shoulder, down the arm. And if you want to do the trigger points, you can put it on the traps, you put it on the posterior occiput in the corresponding level.
Yeah.
And then adjust them or do whatever manual therapy, do traction. I don't care what you do. Just traction would be good.
Okay. All right. Other than that, put it on the spot.
Yeah. Exactly.
Thank you.
No problem.
Jeremiah, I don't know how many people got to see some of the blue sky, and I think I did see a moose walk by.
I'll send pictures because I'm going to be driving because I got to get to the airport
Okay.
later today. So I'll send pictures in the group because I'll have some good ones.
Okay. Anybody else got anything?
Occipital neuralgia? Anything great besides for the obvious?
To me, it's just the obvious. I mean, you go, JJ.
The other thing I would look at is check their thoracic spine because you're going to get compensatory patterns of what they've got going on in thoracic. So check to see what you've got thoracic spine wise. You may need to mobilize, but that way you're not chasing as much of that. And then the other thing would be modify and see if you can't come a little more anterior with the scalenes when you're in the supraclavicular and just go a little bit more anterior. And sometimes you'll see that finally kick in, and then you can get closer to C1 without having to be up in that area.
Okay. I'll give it a go.
The Algea Med website has, like, if you look at the website, they have occipital headaches.
Okay.
And it's literally like 3 points. Like
I definitely think I got them yesterday. She was like, yep, that is it.
It was like the EOP and then down triangular. Is that? Yeah. I mean, yeah.
Yeah. I think she got some. It took the edge off in the office. I need to actually call her back because she was here yesterday afternoon. I just want to check and see, how that headache felt. But she was like, over the weekend, apparently was just a mess with this headache. So hopefully it helped.
it's like you always want to try to figure out the origin of the headache, what it is, and it's
Yeah,
like
she's been diagnosed with that, and then I think either next week or week after next, she's supposed to be having like a nerve block and all of this stuff done. And I was like, let's just give this a go a couple of times and see if we can avoid that. But yeah, she's got neuropathy. I'm treating her for like everything. We just kind of got to focus on something each time, each
It needs
visit.
more patches.
Yeah, she needs more patch.
she
I'm
needs
gonna
more joy
stick her with
patches.
all joy
Joy.
patches. Yeah, she's happy after her visit, so you know.
What website was that?
Algeamed.com. If you look on the Stimpod, it's the manufacturer of the Stimpod. They have a manual online for different conditions.
Oh, cool. That's what I need. Thank you so much.
Yeah, it's one of the documents I actually emailed to you, Dorothy. If
Okay.
you look in the 13 attachments, one of them is called the playbook. That's
Yeah, I've gotten through about 5 of those.
okay. Yeah, that's one of the ones.
Okay.
Great. Tony, got anything?
No, I'm just keep treating myself, and I'm yeah, a lot of low back patients, some neuropathy. Neuropathy's doing real good. I'm really only doing one. Just started one neuropathy patient. He's doing great. I don't really know what to expect. How fast neuropathy patients respond. His is like a second visit. He was like the pain in my foot's gone.
So you don't like put them on a protocol of at least 8 visits.
Okay.
At least. It all depends on how much you want to charge.
Yeah.
And make them stick with it because you can get symptomatic relief, but then it comes back.
Yeah. He's. I told him it's twice a week for 6 weeks.
Great. That's what it is, regardless of what you do.
Okay. All right.
Kenny, anything happening on your end?
Besides stalking Karen on TikTok, I feel I'm an educated guy, but I cannot find these nerves for the life of me.
I didn't see you stalking me. I don't really look. I put my TikToks out there and I'm a really shitty responder.
Yeah, because I reached out to you and I was like, well, maybe I pissed him off because I'm stalk. Every morning I'm at the gym.
Just talk here.
I'm
just talk
following
here.
you. I do a lot of I've been selling a lot of GLP-1s over the years. I have a lot of clients now. I did like an internal email blast, and I did one workshop for neuropathy on Monday of this week, and I've got 8 people that signed up, and I don't know what I'm doing. Yesterday I was trying to find nerves, and I've got a client trying to help me, and I'm just like, what nerves do I go after? I'm using
wait, stop. Just stop.
Okay.
Stop.
All right.
You're making it way too difficult.
And that's what I figured.
Do it on yourself. This is not difficult. You put the big ground pad underneath the toes. You're going posterior. You know where your fibular head is, right?
Yeah.
You're going to put it at your posterior behind your fibular head, and you're going to feel your foot jumping around. And then all you're doing is you go to the medial malleolus and the Achilles tendon and you bisect it and you say, I want you to feel this underneath going to your big toe. This is not brain surgery.
Yeah, and I've done that. And I just, for whatever reason, I can't, and I'm turning it up to like 10 to 15.
No, you got to be on 0.2 milliseconds.
Okay.
So you're not on 0.1, you're on 0.2. And then you're going to crank it up. Like I'm super aggressive. I'm going to be at 0.2 and 20 in about 2 seconds.
Okay.
Is that on all neuropathy patients?
I'm sorry?
I was asking if that was on all neuropathy patients. It goes to 0.2 right away.
Oh, okay.
Always. Like,
Okay.
The more decrepit or infirm the people are, I'm going to start on 0.2 all the time.
Okay.
I don't want to waste any time, and let's just do it. Stop, rip the Band-Aid off. Let's go.
Yeah.
But
okay.
Kenny, always start at 0.2 and crank it up. Do it on yourself. Your head's not going to pop off.
Okay.
The only thing is, if you're doing the vagal stim with them afterwards, you always start on 0.1.
Okay, turn that down. Yeah, I figured that, but I have stem wave, and I also do class 4 laser. That's what I've been doing. So would you do stem wave first and then step into those, or stem pod first?
You could do it in any manner that you want. Doesn't matter. Like it all depends on the package you're selling and whatever you want to do.
Okay.
The lasers are very good. I'm sure StimWave would have. I don't even know what StimWave does.
It's
It's
shockwave. It's shockwave.
Vasodilation promotes, stem
no,
cell.
so it's Shockwave.
Shockwave, yeah. It's super good.
So I would probably do that before doing Stimpod.
Okay.
I would do both of them before doing Stimpod, and then you'll get the results. You'll get your wow factor immediately after that first visit. They're gonna be able to feel their feet.
Okay. Yeah, because I just felt like an idiot. Now I've got a bunch of people starting on Monday.
Yeah, Kenny, call me after the call.
Well, I know you're busy, so I was going to ask Kieran if I could call him because I know you're on vacation. I don't want to bother you.
I'm fine.
Screw Stan. He's never on vacation. He's always on vacation. Let him answer your questions.
Yeah, call me when we're gonna end this call and then hop back on in 5 minutes. I'll go back through it with you, and you will nail these 8 people.
Kenny,
Okay,
where
cool.
are you from? Where are you at?
I'm east of Dallas.
Oh, okay. So you do a lot of GLP-1s on your patients?
I do.
Or?
I have right now. I have 72 people a month on my GLP-1s.
Oh, okay, great. And so, do you also have like a chiropractic clinic, or?
Our anesthesiologist and a PT.
Oh, okay, gotcha. Okay. So, what did you do? Like an email blast to get your dinner
Yeah,
workshop?
I have Jane is my EMR, and I just did an internal thing. Stan hooked me up with the guy that does the Facebook ads, and he sent me a couple of sample ads, and that's all I did. And I mean, I don't know if I'm pricing it right. I priced it at $2,500 a pop.
If you're doing all that, that's
Agreed.
cheap. No, that's you're too cheap.
See, and that's what I figured because I know from talking to Stan and a few other people, there's a guy I kind of just went to his lunchtime neuropathy thing, and he was charging like 5,500.
Yeah,
was
you're
like,
offering a lot
"Damn."
of services. You're offering a lot of services for that's way cheap.
Okay.
Yeah, if you want to get a couple of great testimonials as a result of it, great. But yeah, we'll talk about your pricing.
Okay. Yeah, because I just want to, and I want to bring you guys in to do a seminar because I think I could kill it here.
Yep, you will.
Okay. All right.
Cool.
Thank you.
All right. Well, we'll see everybody next Thursday. I actually will be on the cruise ship next Thursday.
Oh, it's tough.
So I'll have, instead of hotel room behind me, I'll
Tanaya.
make it.
I want to be Stan when I grow up, okay, Kieran? I want to be Stan.
Stan's been fucking around
Stan's
for
been
the
on
last
another
50
cruise.
years. Stan hasn't had a real job in 50 years.
Never had one.
Yeah, I know. It's
See,
great.
I'm doing it all wrong.
I got the job. I'm locked down forever. So great.
All right. Well, we'll see all you guys next week.
All right. Thank you.
Thank you.
Bye.
July, everybody.
Bye.
Thanks.